And when we look through a trauma lens, I think it all begins to make sense. So we have 4 different trauma responses: fight, flight, freeze, fawn. So those of us who present with a fight response, maybe those who come across as narcissistic, bullying, sociopathic, but this is how they have learned to respond to trauma, and when they're triggered, they tend to go into a fight response. Those of us who have a flight response might go into things like OCD, rituals, behaviors, trying to control a situation to make us feel safe, addictions, using substances or behaviors to regulate ourselves. ADHD could be seen as a flight response and kind of going back and forth from the sympathetic to dorsal nervous systems, from the hyper-focus to the hypo-focus, the hyper-attention to the hypo-attention. And then we have the freeze response, which can look like dissociation, not being present, being a bit cut off. Dissociation can look like, just losing track of time, for example, not even really knowing what's gone on. Depression, being quite shut down, not feeling much, being numb. Also phobia, just needing to avoid certain situations because they're overwhelming. Then we have the fawn response, which is the tendency to people please, to try and make peace, to try and make things okay for others. It's very other-centered. If we're raised by a parent who's very volatile emotionally, or an addict, for example, we may not really be able to focus on ourselves growing up and what we feel and what we need. We may need to focus on regulating them and making sure they're okay, because if they're okay, then we're going to be more okay. So that's where we tend to develop the fawn response, which can show up as codependency. I need to make sure you're okay so that I can be okay, rather than looking after myself directly. So people who demonstrate the fawn response can tend to be caretakers, people that are more comfortable looking after others than themselves. They can be quite self-sacrificing, so they can abandon themselves, not think about what they need, not set boundaries, and really become preoccupied with what the other person needs. And those of us who have that type of trauma response can end up attracting other people who have a more of a sort of fight response, like narcissists, because when we fawn and we look after others and abandon ourselves, that really is an invitation to someone who needs that and wants that from us. So we might, for example, have adapted to having to look after others in childhood, and then we attract in adulthood in our relationships people who need us to focus on their well-being and not our own. So that's a really good reason to begin focusing on our own healing our own wounds, self-partnering, rather than looking after others.